Hello, I'm Dr. Niel Burnett, Doctor of Physical Therapy with Vo2 Physical Therapy, joined with George Burnett.
George Burnett. I'm in charge of healthy eating side of this Vo2 Physical Therapy, and it's good to be here together.
Yeah, thanks for watching the video and joining us. Today we're talking about the 4 scores, so really where the name Vo2 Physical Therapy comes from. And we're going to be taking George's 4 scores, and these 4 scores are health indicators, help you stay on track with your wellness goals, and really where our wellness program revolves around is these 4 health indicators. So
I'm excited about getting my 4 scores.
Yeah.
Okay.
So real briefly, I'll
Okay.
go over them. The
Okay.
first one is going to be resting heart rate, and then it's going to be blood pressure, and then right after that, we're going to take a fitness score.
Okay.
And then the last one is your antioxidant score. Okay. So those are the 4 scores that we're going to be taking today. And so let's start out with the resting heart rate.
Okay.
Okay. So the device that we use is called a pulse ox, pulse oximeter. It's used to see what your heart rate is, and sometimes you warm up the fingers.
Okay.
Kind of breathe on your fingers a little bit. That helps to make sure we get an accurate. There we go. Okay. So just put your finger in right there. Okay. And this will tell you, this little device does tell you what the oxygen saturation is inside the blood, but then the other thing that it will do is tell you what your heart rate is, and that's what we're going to use it for today. Okay. So right now we're getting a reading of 68 looks like right now. So that is good there, so we'll take that off. Okay. So we got a heart rate of 68, and I'll write these down for you, George. If when you're on your own, you can write them down as well, but we're going to put down 68 beats per minute, and that's a pretty good score because you want your resting heart rate to be between 60 and 100. Okay. You want a lower resting heart rate because when your heart is pumping more effectively, it doesn't have to pump as many times per minute. When you have a really high resting heart rate, so it's in the hundreds or above 100, sometimes I see patients in the 110, 150 even at resting heart rate, and that's dangerously high if you get too high like that, and that just means that the heart has to keep pumping a ton, and it's just not as effective of a muscle. So as you exercise more, you get stronger, your heart gets stronger, and then with each pump, it can pump more blood out to your body, and that means that then it doesn't have to pump as many times per minute.
Cool.
So lower resting heart rate's good. It's between 60 and 100 is good there. Okay, cool. So we'll put that one down here, and next one we'll do is the blood pressure. Okay, so let's take this out, and
we're going over which aren't.
Yeah, we can do. You can do.
Hey, I dressed for the occasion.
That's right. Yeah, tell us about
my late 70s running suit.
Nice.
And I was never on high school or college track or anything, but on a church service for a couple of years, we did this, and it was this was our running suit. It was 2 miles or 20 minutes, whatever came first, and we bought these. So anyway, I had to dress for it today.
That's awesome.
Still like having this.
You still fit it.
Still fit it too, yeah.
So that's good.
That's a good thing.
That's a good thing. Yeah.
Okay, we'll take this off though.
Okay. Sounds good. So you can use right or left arms with this. A lot of the times we've been using the left arm. I like using the left arm. But again, you can use right or left. But the more important thing is that each time you test, you try using the same arm. And you try to kind of test in the same conditions. And that'll, over time, that kind of gives you a more accurate result of your test there. Okay.
And do you want to talk about if some of our folks on the program, if they're not with you, I mean, we're going to be doing this for those on the program that are within a range that we can actually, that you're going to be able to.
Yeah, that is good. So these are devices you can use at home. Obviously you can do them with a clinician, but this is a device you can order online. $20-$30 is some of the cheaper ones. They can go up to about $100. But again, just a resting heart rate. You can take your resting heart rate at home very easily. And also this little blood pressure machine you can get for decently inexpensive as well. But it's nice that you can do this at home. So it's really simple. You just put it on your arm like that. Okay, and I'll move this aside for a second. And you just press the on button there, and then it's gonna blow up the air inside here and actually take the blood pressure. And so again, these are things that you can test at home if you're not with us, which a lot of you aren't. a lot of you are at home and on the program still, and these are scores, health indicators, health scores that are really important to be tracking on a regular basis. We recommend once a month to be checking these numbers.
And those on the program are going to be getting with you.
Exactly.
And then they can print out the 4-score sheet.
Yeah, this little 4-score tracker sheet right here, and that's important to be able to have kind of your tracker in a location that's where you can see it. Okay, so George's blood pressure's out now, so just gave us this. So we have on here, you don't mind? Do you mind if I tell the crew here, George, what your blood pressure is? So 125 over 76. Okay, nice.
Tell us about that.
Yeah. Okay. So your blood pressure is. Blood pressure is important because this is really the pressure that is acting against the heart as the heart is trying to push blood throughout your body. Okay? So you think of, like the rest of your body, it has all these arteries and veins inside it, which are like pipes that your blood, your blood runs through, so your blood vessels. And so for the blood to run through those pipes, you think of a pipe, that if a pipe is clogged up, or you got a really small pipe and then you get some gunk inside there, then there's going to be more pressure for that heart to push the blood through it. Okay? So when they say, okay, you have a high blood pressure, and you get your blood pressure down, really what they're talking about is that the vessels, or those pipes that you have inside your body, those are either clogged up or they're contracted too tight, too small. Restricted. And yeah, exactly, restricted. So they've gotten small. There's the area for the blood to push through is too small. And so the ideal thing that you want to do is be able to get your blood pressure down. So the new recommendations is that you want your systolic blood pressure, so that's your top number. You want the top number to be below 120. Okay. And you want your bottom number to be below 80. Okay. There's we'll look it up, we'll give you kind of the actual charts there, but really those are the two kind of golden numbers to remember right now, is that my top number I want to be below 120, and my bottom number I want to be below 80. Okay. So as those two numbers get higher and higher, if you are unhealthy, or and not taking care of your blood pressure, then that's when your heart's working too hard and your body's not getting adequate blood flow typically because of that increased blood pressure and resistance. So
I'm pretty close.
So you're pretty close. So again, George's score was 125 over 76. So my recommendation would be, yes, we need to continue to work on that systolic blood pressure, see if we can get that a little bit below 120 would be ideal. Yeah. Okay. So, and diastolic, so that bottom number is below 80, so you're good to go on that. Okay, cool. So that's looking pretty good. Okay. Overall, that's still a very good blood pressure across the board. Again, even though you don't fit inside the ideal conditions right now, it's still very close to being a great blood pressure.
And if you had really high blood pressure, it's the arteries are the vessels are kind of clogged, but that leads to doing what? So it leads to what happens when that happens?
Well, you think about, if you have a pipe that's clogged and you have an engine the engine is pushing water through this pipe. The engine has to work harder and harder because it can't push the water through effectively. So it's the same thing. So your heart is like the engine, your body's engine. And so your heart just has increased resistance and increased pressure on the heart. So it's more work. So your heart gets unnecessarily overworked, and then that leads to cardiovascular disease, heart disease. That's why they call blood pressure the silent killer, because oftentimes you don't know what's going on, that you have high blood pressure until you eventually get heart disease, and then you realize that you've had high blood pressure for a while and it's dangerous. So
good score to
good score to know. Yeah, very, very important scores here. So, okay, so the next one, and again, we'll have more videos about each of these scores and kind of go into details on that. And again, with all of these, we recommend that you consult with us, jump on a Zoom video call with us, and we'd love to talk about your scores and help you do these scores so you find out what your numbers are. And that way, again, we can help consult you and give you advice on how to reach your health goals. Okay.
Yeah.
So next score is going to be your fitness score. So we've done 2 of the 4 scores.
Okay.
We're on the 3rd one right now. It's going to be your fitness score. Okay. So
Okay.
the fitness score. This is a little test that was developed at Harvard. It's a modified Harvard step test. Okay. So what we're going to have you do is I'll have you stand up, George, and I have a 12-inch. Oh, go ahead and just set that step up there. So this is a 12-inch step right here that George is going to be stepping up on. Now again, I recommend that if you are to do this at home, you consult with us first, okay? Because there are a few things to keep in mind, and those are, if you have high blood pressure, there's contraindications not to do this test, and that's if you're having a high blood pressure where your systolic is above 160 or diastolic is above 100, and then also if you have any other like lightheadedness, confusion, if you're feeling off balance, and a few other contraindications there, please consult with us before you start this exercise test. It's still a pretty reasonably safe test to perform at home. But again, I have George placed right here in front of the step, and then also a couple walls next to him is a good idea too, in case if for some reason you lose your balance, you have a wall there so you're not falling down. Always good to have a few precautions there.
I can see the step pretty good. Okay.
Yep, there you go, thanks. So again, the test is performed with a 12-inch step right there. And now what I'll do is I'm going to have a metronome here, and George will step up onto this, to the beat of the metronome, up and down on this step consistently for 3 minutes, okay? And so up and down for 3 minutes, and then right after 3 minutes, I'll have George come sit down, and then after a minute of rest, we'll check his heart rate, okay? And we'll talk a little bit about that, but let me get the metronome here going, George, and then we'll get you started, okay? And I'll also get my timer here set. So again, we've already checked George's heart rate, so resting heart rate, blood pressure. So he already has good scores, and I don't have any kind of contraindication of why he shouldn't do this step test here. So we're going to go ahead and get started. Okay, here's the metronome, and then George, you'll hear the metronome first, and then I will go ahead and step when I say go. Okay, ready, set, go. So he's up, yep, just like that. Up, up, down, down, up, up, down, just like that. So George is going to be doing this for 3 minutes here, while I just sit down in my chair and enjoy. So, I'll talk a little bit about this test here. This test is done to really show how well the heart is responding to physical exercise. Okay? And again, this is our fitness score here. And eventually you may realize that this is a test, and you may work with us that, and if this is a great test to check your score on monthly, but you may have your own fitness score, a fitness score that we develop with you, and it may be a mile run or a 5-mile run, or maybe it's even as simple as something like, I've really been wanting to work up to being able to take my dogs for a walk for 20 minutes. And then we can quantify that. The most important thing to do with your fitness score is be able to quantify it so then you can track your progress in the future. So let's say it's a mile run and you time your mile run, and then eventually, you're starting to get a better time on your mile run. And so that's something that we can work out with you and figure out what your ideal fitness score is. But this is the one that, again, Harvard developed this to tell us really what our fitness is telling us and how fit our heart is. So George is just about at 2 minutes, so he has about 1 minute left. And again, George, you're not feeling lightheaded, dizzy, you're doing okay here?
Feel pretty good.
Okay, great. That sounds good. So again, he's just staying to the beat of this metronome here. So there's a true fitness test would be a full, what's called a Vo2 Max Test, which really tells you how well, how fit you are, but then also how well your body is consuming and using the oxygen that it takes in. And then it can tell us what your max heart rate is. Now this is really a modified way to do that type of test, but it's a nice way to do it at home, minimal equipment, and again, you could do this on yourself even after a few instructions from us. Okay, so George, you have about 10 seconds left. Keep going there. Okay. Okay, and stop. So come on over. Yep, come on, sit down.
Okay.
There you go. Okay, good. So I'm gonna have George sit down now, and we're just gonna wait a minute. But in the meantime, I'm actually gonna get our heart rate monitor and put it back on his finger here. Okay. So I'm gonna be watching this. Okay, so I'm just gonna be watching his score there, and as his heart rate comes down, let me get this metronome turned off. To find the metronome, I just Googled metronome, and comes right up. Okay, so beauties of Google now. So we got another 30 seconds before I actually get his heart rate here. So really, what I'm looking at is during exercise, normally your heart will increase. So it'll start beating faster and faster and faster, and you want that because your heart recognizes that your muscles need more oxygen, so it starts pumping the blood out. But then after you sit down, we want the heart to be able to recognize that you're not exercising anymore, and it brings your heart rate back down. Okay, so we're gonna check his heart rate. Okay, so we're now a minute out, and we have 73. Okay, so that's pretty good, because that's what that's telling me is, when we first put this on, you were up in the 90s, so you increased by about 20 beats per minute. But the more important thing to me is to see that it's coming back down closer towards what is resting heart rate. I wouldn't expect it to be back down to 68, what your resting heart rate was, but I expect it to start climbing back lower. Okay, so that's good. So we got that one there, and so again, and then eventually, as you continue to become more and more fit, you'll see that your heart is able to come closer towards your resting heart rate after rest, after exercise. Okay, so that's your fitness score. Okay. Now we're moving on to the force score. Okay, so and that's your antioxidant score. Okay, so we're going to use this machine here called the biophotonic scanner to do that. So let's go ahead and pull this up here close to you. Okay, and we use this little iPad here as well to get this. I'm
pretty familiar with this one.
You know this one, so George, you can help talk about this one here too. But we'll get you set up on this. Good. George is a certified scanner for this scanner operator, and we are going to get this set up here.
This is the one that intrigued me so many number of years ago when this rolled out. Measurement of antioxidants. Healthy eating, which I'm in charge of, that's going to affect a lot about the antioxidants in the body, which affects how well your cells are protected. So, yeah.
Exactly.
It's all good.
Exactly. So, okay. So this one, George, why don't we put this on and you tell us a little bit about, just briefly about the technology that's used here. Okay. But let's go ahead and get you set up first. So we're going to take this off. Okay. Take our cap off there. Okay. And I think we had already got it ready. So go ahead. Let's go ahead and put your hand
on here. We put in the name and an email.
That's right.
Get email. We kind of prepped that up, so that was ready to go.
Okay.
And then a beam of light's going to come out right here. Using this kind of thick pad of flesh right there. This beam of light's going to look at that pad of flesh, and it's really looking at levels of carotenoid antioxidants. Thing that I was intrigued with in giving seminars. So it's going to look at that using light, use something called Raman spectroscopy. And all molecules in the universe reflect different colors of light. And so they're able to, and in some great scientific research, identify that, and then...
We can share all those articles with you and show you more of the research here. So what we got going is we're going to get George's hand put on here. Again, the laser's going through there and measuring his antioxidants now. So we're getting the force score, which is his antioxidant score. And again, like George was saying, this improves through healthy eating, nutritional supplementation, and also living a good active life. You know, staying healthy. So we are getting this coming up here. And so what we're looking at this iPad here is this is giving us the report here. So we're going to see what his score is. This is getting up to the highest zone, and George is at 72,000.
Okay.
Good job. Okay, so I'm going to write that into his chart here. Good job.
So you want to be in that top zone. There's actually
the platinum zone.
Platinum zone.
Okay.
There we go. Cool.
Okay,
30 seconds. The really amazing thing about this is 30 seconds now, non-invasive, no blood drawn. Although a similar test can be done with blood.
Yeah, you can do blood serum tests where they draw the blood out. They can test the antioxidants in there. But actually, this machine has been proven through clinical studies that it's actually more accurate than even blood serum tests.
Yeah.
So
and
pretty cool and fast and just boom, you get it right there. Yeah, let's see. I'm not sure if the lighting will really see this here, but really what we have is a indicator, a chart here that just he starts down here from 10,000 all the way up to 90,000, and it gives you your score here, and really what is most important is that you get in these zones. Okay, so I'm not so concerned about the exact number as in the zone. What zone are you in? And what George is in the platinum zone, so the highest zone here. And so when you get your score, you'll kind of figure out what zone you are. And the goal is, okay, if you're in kind of the yellow zone, the 30,000, or maybe you're in the orange zone, 20,000.
Average zones.
Those are the average kind of America. Most America's the kind of the 10 to 20,000 kind of 20,000 zone. Is that right?
Yeah, that's right. Basically, up in this zone, up in here, this orange zone here.
Yeah.
Yellows to the yellows back over to the orange. That's average American there. Not
exactly.
eating enough fruits and vegetables.
Yeah.
Not getting enough exercise.
Right.
Carrying too many extra pounds. So a lot of things, and then just stress and pollution and toxins.
Yeah.
All affect this score. So those are things, and you want to get that score high. Why? Because again, cells are protected by antioxidants. Free radicals damage the cells. We'll go into that some more.
Yeah.
Anyway,
Lots, lots more for that. But again, those are the 4 scores. Now, a couple things I had set out here is this is some mushroom supplements. Actually, cordyceps mushrooms, which actually there's some really good. You look that up. Benefits of cordyceps mushrooms for George with that aerobic step test that we just did. Some really cool research about how cordyceps mushrooms can help improve your aerobic endurance. So really give you more energy, especially for that exercise, and give you that extra boost as well.
Pomegranate in there.
Pomegranate, some other several other good things. The one that I've looked up a lot is the cordyceps mushroom, which is huge for energy and blood flow. Mm-hmm. Also, that's a good thing too for sexual health as well. So that's just a little plug there as well.
Take this one every day.
Yeah, blood flow's huge there. And then this is one too, is the flex cream. So as you are exercising more, we'll talk a little bit more about this, but the flex cream is nice. Throw it on those knees, throw it on those sore back. I think you used some the other day, George.
You've been pushing me with the exercises a little bit more, so I've been using that now. That flex cream. Yeah. And absolutely.
And then we got the protein. That's the protein container right there. So that's some good quality protein. I like a plant-based protein, easy to digest, and you're getting the amount of protein that you need, which is about 30 grams in each meal. But we'll talk more about that down the road.
Great ingredients in here. I use that every day. I use this every day. Yeah, we both do. These are good things.
So really what we want to tell you here is that we have the plan to help you improve these 4 health indicators, your 4 scores. And so we've tested them on George. We'd love to test them with you as well. And we can do that through a Zoom call and getting you connected with a location that has the biophotonic scanner. And it's important to track these. This is the tracker. This is George's tracker, and that's every month we're going to be tracking that throughout 2020. Okay, so we'd love to do that same thing with you. You can jump on a Zoom call and find out more information at 4scorept.com. That's the number 4 and then scorept.com. So anything else, George?
I think those 4 scores are really important. Yeah. And knowing those zones, knowing those scores, knowing those zones, and improving those, it's we want to be our best. We want to help others be their best. And this will help you, because if you don't have your health, you can't be your best.
Exactly.
And you can't do all the things that we want to do. We love doing outdoor stuff.
Yeah.
We want to help you do those kind of things. Stay healthy for a long, long time so you can be a value and benefit to those around you. So anyway, looking forward to having you on the program with us.
Thanks so much for watching. You can see more at fourscorept.com.